Today we're going to talk about alcoholism. Drinking alcohol is a part of Canadian culture. About 80% of the population drinks alcohol every year. Of this, 4.4 million are at risk for chronic health effects, such as liver cirrhosis and various forms of cancer. So when is drinking a concern? According to the DSM-5 criteria, alcohol use disorder is based on 11 symptoms, where at least 2 must be met within a 12-month period. It includes such symptoms as alcohol being taken in larger amounts over a longer period of time than was intended, or having cravings. With such a diagnosis, it's important to recognize its long-term health effects, such as cancer and cardiovascular disease. Let's look at a patient case to put things in perspective. George walks in looking for help with his alcohol abuse. He's a 30-year-old male, and he's a junior marketing executive. He drinks 5 standard drinks a day, 25 in a week. He craves the taste of alcohol. He recently started calling in sick more often because of headaches and nausea after nights of drinking, and he stopped playing basketball every week so that he can go to a bar with friends. How can we support him from a nutrition perspective? Thiamine is an important vitamin in the body and is often deficient in those who are alcoholics. This is due to inadequate nutrition intake, impaired absorption in the intestines, impaired storage and usage, and increased requirements from alcohol metabolism. Symptoms of thiamine deficiency include fatigue, weakness, and emotional disturbances. As the problem continues, it can lead to dry beriberi or wet beriberi. If the deficiency is severe, it will lead to Wernicke's encephalopathy and then to Korsakoff's psychosis. Wernicke-Korsakoff syndrome is common in individuals who abuse alcohol and usually caused by thiamine deficiency. It has an acute onset and includes symptoms of ataxia, nystagmus, polyneuropathy, disorientation, and other mental disturbances. If untreated, it can lead to long-term care or even death. Let's look at the research. An Australian study looked at the diet and supplementation of thiamine in diagnosed alcoholic patients. When looking at their diet, they found that these patients were at risk of thiamine deficiency because it was low in their diet, even when eating foods fortified with thiamine. Research also showed that these patients who took regular supplementation of thiamine had higher blood levels than those who did not, and it is important to mention that those who had supplemented had levels comparable to those of healthy patients. A double-blind RCT studied whether the analog of thiamine called benfotiamine would be effective in reducing alcohol consumption and had any adverse effects in alcoholic patients. The results show that no significant adverse effects were found, and that there was a significant reduction in alcohol consumption, especially in the women counterparts in the study. Although the 2 previously outlined studies show benefits for thiamine supplementation in alcohol patients, good evidence is still lacking. A Cochrane meta-analysis analyzed thiamine supplementation on preventing and treating Wernicke-Korsakoff syndrome due to alcohol abuse. Only 2 RCTs could be found. Dosages in both studies were both very different, where one used 5 milligrams per day and the other used 200 milligrams per day. So what dosage should an alcoholic abuser use? It is recommended those who are at risk for thiamine deficiency to take 50 milligrams per day orally or 50 to 100 milligrams intravenously 3 to 4 times a day. However, it's still up for debate as the Cochrane review outlined, and no confirmed dosages are present. Let's look at selenium. Selenium is an essential micronutrient for a healthy liver. It is needed to create the antioxidant glutathione peroxidase, which helps alter oxidative stress in the liver. So why is selenium with alcoholism? Along with its antioxidant properties, it helps inhibit pro-inflammatory markers such as TNF-alpha and interleukin beta, and also helps promote the release of anti-inflammatory cytokines. Moreover, it helps prevent hepatocyte apoptosis, thus decreasing liver damage. Studies have shown that selenium levels are lower in alcoholic patients, and especially with those with alcoholic liver disease. There is a correlation between low selenium levels and decreased activity of glutathione peroxidase. Selenium has a direct correlation with glutathione peroxidase and lipid oxidation. This suggests that selenium levels can be an indicator of hepatic damage and could be a possible antioxidant therapy to help those who are alcoholics. How much should we dose? While there aren't conclusive studies on selenium dosages, this supplementation in alcoholics seems promising. One study showed that the antioxidant effects of selenium showed benefit with 100 microgram dosing per day. If they're not supplementing, they could also try and find selenium in foods such as Brazil nuts. Our final treatment plan for our patient George will include an oral supplementation of thiamine as well as one of selenium to help prevent any further oxidation damage that would have occurred with his excessive alcohol use. We will also recommend a diet and lifestyle change, which includes one high in proteins and fats, and then also encourage him to commit to this lifestyle change in order to produce long-lasting benefits. Thanks for watching.